Today we've got an amazing moderator, a dear friend of mine, as well as a great panel of experts. I know this will be a lively and informative conversation with valuable insights. It is a conversation, note that. And so now let me get a couple of factoids for you. A report recently released by Virginia Senator Mark Warren, who's the co-chair of the Senate Cybersecurity Caucus and chair of the Intelligence Committee in 2021, stated cyber attacks on healthcare providers have reached an all-time high with more than 45 million people affected. Now, I just came out of Chime, which a few of you know that's where the CISOs, the CIOs, and CTOs are a part of. But this report was highlighted there, and it's a 2022 healthcare IT security report entitled Cost of the Data Breach. And it stated that healthcare is the biggest target for cyber attacks. 57% of healthcare organizations have now reported being hit by a ransomware attack in the last 3 years. And of those who have experienced a ransomware attack, 60% revealed that the attacks disrupted some form of business process, including patient care, completely. About 22% of those organizations report an increase in mortality rates post the ransomware attack. Thus, healthcare is particularly vulnerable to cyber attacks, personal information, which is now more valuable than our own credit cards. Cyber attacks are detrimental to patient safety, as well as they're costly for each and every single one of us from a provider perspective. A single data breach can end up costing millions of dollars, as well as the trust of the patient, the consumers, as well as the community. This afternoon, our panel will talk about many facets of this issue, including cybersecurity regulation, data protections for practitioners within the clinical environment, the complexities of paying ransom to hackers, and the best practices for employee training. Before we jump into conversation, I want to take a moment to recognize and thank Ethical Intruder, our premier sponsor for today's event. Ethical Intruder is an industry-leading Pennsylvania-based cybersecurity compliance risk firm that works as a trusted advisor to guide organizations in becoming as secure as possible with their existing products and technologies. It provides both security services, including compliance and risk, incident response, tabletop exercise and vulnerability management, penetration testing, phishing, as well as security. Joining us today to introduce our event moderator is David Kane, CEO and founder of Ethical Intruder. David, thank you for your support.
Hi, thanks everybody. So first of all, yes, we are actually a Pittsburgh, Pennsylvania-based company. And thank you. That being said, I grew up here in Cleveland. If anybody ever asks me where I'm from, I immediately say I'm from Cleveland. I don't know if this is a good thing or a bad thing, but I bought Browns season tickets again in 1997, 2 years before we actually had a stadium and entertainment. I've had season tickets ever since. So I own a company in Pittsburgh, but I'm a Clevelander. We have Cleveland customers, so.
We still love you.
Thank you. So anyway. So I founded Ethical Intruder about 12 years ago. Our primary customer base over the last 12 years has been healthcare, medical IT, medical device companies, life sciences. In the early days, we started out working with, our first few clients were Humana and UMass Memorial Hospital. To be honest, you start a company and you work with a Fortune 70, 50 company, you think they're all going to be like that. It doesn't really happen that way, but it was nice to start out working with Humana. We started working with UMass Memorial Hospital. We did a lot of work with them on their vendors who were going to integrate into their systems and make sure that they were actually secure and not going to actually cause a problem. We've seen a lot of changes in the space over the last 12 years, from primarily focused on HIPAA and high tech now to high trust and FDA regulations for medical devices. We've seen requirements and compliances obviously grow, which we'll talk about today, I'm sure, a lot over the 12 years. We've also seen budgets get smaller and requirements grow, and those are always, it's complicated in this area. But there are some things that have stayed the same. I actually was speaking this week in Toronto, Monday and Tuesday at a cybersecurity conference, and they spent a lot of time going over some big attacks over the last few years, a lot of them related to cybersecurity. One of the things that they wanted to talk about was the sophistication of the attacks, how they pivoted through the systems in order to get healthcare data, the types of tools that they were using to detect it. But the interesting thing, and one of the things I wanted to focus on today, is in each one of those case studies that they did, they all started out almost exactly the same. The company had poor passwords, old passwords. They had software that was out of date. They did not have good asset management, which everybody thinks is really boring. So in a lot of cases, it was like, oh, we didn't even know that that asset was still there. We thought we decommissioned it. It had old software. We weren't even monitoring it with any kind of tools. So the point of this is that even though there are more and more sophisticated attacks and there's better and better tools to catch it and all sorts of things to do, the tried and true cyber hygiene and the things that you can do and do with your organization without necessarily spending too much money, it's more resource time, is I think still very important, right? Almost all of these case studies that they went through wouldn't have been a case study if there were certain things that they had put into place. I know from a security expert, those are not the areas that are necessarily fun or sexy or exciting often to work on. Nobody wants to say, let's tackle asset tracking today, and that's just never a fun topic. But there are things that you can do that I think that are really important. Again, spending time on asset management inventories. Don't just scan for vulnerabilities, but actually have a vulnerability management program. Incident response tabletops to practice for when you actually do have an event like a ransomware attack is super important. We were doing 2 or 3 tabletops a year before the pandemic. Now we're doing 2 or 3 a week. And what's really interesting is that the leadership tabletops, the executive team tabletops, even in hospitals and the various medical organizations, have really been a huge strength, because then people know what to do when the actual emergency actually hits. So again, I think there's a lot of great topics that we're going to talk about. I've been on a bunch of these panels. I've hosted them before. I think that the overall awareness is so huge, but again, always like to leave that reminder that sometimes it's spending some time on the basics and the fundamentals will take us, quite a long way. I always like to tell our customers, if you get hit by a cyber attack, I'd really like to say it was because we were way outsmarted and there was just something that they did that just, we tried everything that we could have. But when it's, passwords, old systems, asset management, privilege management, then you sort of have to go and look internally a little bit as well. All right, I want to go ahead and introduce our host tonight. So Andy Jones, CEO, Fortress Security Risk Management. Andy and Fortress are dedicated to protecting clients from financial, operational, and emotional ravages, I like that, of cyber attack. He is a security and IT industry veteran. Andy is an engineer at heart and views the world through that prism. Key focus is to provide the vision, strategy, roadmap for Fortress operational infrastructure with an eye towards substantial and sustained sales growth, which is pretty good. Andy's wide-ranging passions have also helped to attract and retain talent in cybersecurity, which is so important. Big data analytics, working with the team he has pursued, the orchestration of people, processes, technology, and governance in a format that promotes Fortress' long-term development vision. Andy serves on numerous boards, is active in raising funds for charities, being instrumental in helping to raise over $1 million for cancer and diabetes research and treatment, which is pretty great. So anyway, I will go ahead and turn it over to Andy. So, and I'll be here afterwards. Hope to meet some of you. Thank you.
Okay, good afternoon. That was a completely unnecessary and over-the-top introduction. Everyone that knows me knows I just cuss a lot, but I was told I'm not allowed to do that today. So we'll move on. As Dave said, Andy Jones, CEO for Fortress. We're headquartered here in Cleveland, Ohio. All we do is help organizations manage their cyber risk, identify it, quantify it, remediate it, We'll talk a little bit about some of those steps later, but I'll be around if you have questions. I think I'd rather hear from our distinguished panel. So if we could real quick, I'd like to start on this. And Dave, if you could, maybe a quick introduction, your role, and
Sure.
why I talked you into this.
Good afternoon, everyone. My name is Dave Fiser. I'm a Vice President and Chief Information Officer for the MetroHealth system. I've been with the organization now just about 4.5 years. Prior to that, I was the CIO for Akron General Health System for 10 years, actually 32.5 years total at Akron General. Got a lot of background in healthcare IT. I've been born and raised in it, and looking forward to this discussion today. Thank you.
Thanks, Dave. Brian?
Good evening, everyone. My name is Brian Ray. I teach at Cleveland Marshall College of Law, where I co-founded and direct our Center for Cybersecurity and Privacy Protection. So I'm the only one on the panel that doesn't either serve clients or an organization. I just get to talk to lots of smart people who do and teach students to try to understand how these things work. So we have a lot of interesting programs if you're interested in learning about learning more in this space in a formal way. But I'm also very pleased to be part of this distinguished group.
Thank you. Fran?
Yeah, my name is Fran Goins. I'm a partner at the law firm of Ulmer and Byrne, which is a large Midwest-based firm. And we service mainly business clients, so we are a full-service business law firm. My background is in litigation, and I got into cybersecurity through a class action suit with a bunch of folks who'd been hacked, suing a web host, NCR. You might have heard of them. NCR was our client. There was also a bank. They'd put up a website for the bank, and the bank ran all of its processes through this unsecured website instead of steering people to a secured website. And so, as you might imagine, that didn't go so well. We did get out of the lawsuit, and after that I got involved in cybersecurity. So I've been in this space for about 12 years. I co-chair the firm's cybersecurity and privacy group, and I'm very pleased to be with you today. Thank you.
Thank you, Fran. Chris?
Good evening. I'm Chris Bowman. I'm with Vertilocity. We're a subsidiary of the Hillbarth King Financial Group. And I've been primarily involved in IT on the networking and server infrastructure side. I had a focus in backup and disaster recovery, and that's how I found my way into IT security. So I've been with Vertilocity, the organization that it was before, for about 12 years. I've been very involved in direct support of small clients, usually between 20 and 200 users, with a focus in the healthcare space. So we provide everything from just the general IT for a small office to consulting for an organization that has its own internal IT but maybe needs to bring on additional help for a project. So I get involved in various aspects, and as a vCIO, my role has shifted more towards consulting and having those discussions with ownership and with board level discussions about IT strategy and IT security, and how that how the organization is impacted by that, and the importance of it.
Thank you. Jeff?
Good evening, everyone. Jeff Fortunato. I'm Assistant Special Agent in Charge here in FBI Cleveland. In that capacity, I lead what we call our National Security Branch. So I have oversight of our portfolio that includes everything involving counterterrorism matters and also nation state, in other words, Russia, China, Iran. I've been in my current position for about 5 years. Among our teams in the branch includes a team dedicated solely to working cyber nation state activities. We work both ends of the spectrum in terms of working with the victims here in the community, but also our adversaries are all sitting overseas. We work side by side with a team that handles everything involving what we call cyber criminal. So it's a pretty expansive portfolio from the cyber side of things. What's unique about our team here and our colleague offices across the country that handle this matter is that all of our subjects are sitting in Tehran, Beijing, and Moscow. And the way the Bureau has its model, no matter where they pop off in the world, or what they target in the States, a team for a specific office handles that. So the guys here have a pretty unique perspective, as every office does, that handle these matters into the full life cycle of these operations and the blurring of lines between nation-state actors and cyber criminals.
Excellent. Okay, I'll start the first question. I'm going to key off of something Brian said earlier. I think the last session that was conducted here was on workforce, and I'm sure there was a conversation around remote workforce, telework, and whatnot. Obviously, with COVID, we saw massive acceleration in workforce virtualization, work from home, and whether that's the new norm or it's the new norm for some people, it's been relatively disruptive, not just to the IT environment, but to the business process. So I'm going to throw the first question, if it's okay. David, if you would, how has telehealth, telework, remote work impacted your cyber posture strategy, positively, negatively?
Yeah, just a little bit of background. Prior to COVID, we had very few remote workers, just a handful, quite honestly. When COVID hit, we did a complete rapid flip. If you could imagine, thousands of employees that needed to get connected. So we had to quickly ramp up our services. At that time, a multi-factor authentication was out, but only a select number of people used it that needed to get in remotely. So you can think about expanding that overnight. The same thing happened with patients needing care. We had to quickly flip to telehealth. We also had phone visits as well. So two of those options were out there. Literally thousands of patients were affected by it. So as far as the infrastructure, we could pivot pretty quickly. We had the infrastructure in place. We had to enhance some of our connectivity, but all of the security components were all there. We've standardized on all of our equipment, so anybody that had to go home had a MetroHealth device already loaded with all the security features and everything else that we require. So it was a matter of flipping them to their home and then getting them set up and making sure that they had bandwidth to be able to perform, their jobs every day. So we pivoted very quickly and were able to really not affect the operations very much.
Any other board members, panel members? Experiences, thoughts? Chris?
I would just say in the small business space, it was a huge challenge. I had clients literally calling me on a Friday afternoon, and they had a complete no work remote policy and absolutely no provision for it, and tell me we have to be 100% remote by Monday. Make it happen. There were huge challenges in the small business space, and a lot of them had heard of I just need a VPN, and I start talking to them about multi-factor authentication. Why would I need that? So education in that space was a big deal, and trying to get people to understand you're changing the profile of your organization now, and you have somebody that's working remotely, and you've now got to be concerned not only with the security of your organization and your data in your business, but when they're working from their home, and are they printing documents in their home? What's happening with those documents? Is it being handled in a compliant fashion? And what other devices are on their network, and how do you account for that? And so it was a pretty huge struggle that frankly we're still going through, not at quite the breakneck pace, but yeah, it's a big challenge in the small business space.
So we've seen organizations struggling with the remote management of the devices, the security of the devices, that posture, whether they are able to secure the connection with VPN and multi-factor. They're still struggling, to your point, of not only securing the data physically, whether it's printed or not, but the digital footprint that exists on their local devices. So healthcare sees this a massive expansion of connectivity outside of their four walls or their physical plant, if we think of it in a more traditional sense. But you're also seeing expansion inside, whether it's multiple devices. Most doctors have 37 IT gadgets on them at this point, if there are any doctors in the room, sorry about that. But we're also seeing this medical IoT coming along, and coming at a breakneck speed. Where does that play into your thought process? And I'll tee up the thought process as well. And Dave, I'll probably throw that back to you to start. But given that many of these devices are manufactured not domestically, how does that play into your strategies?
So what we do with medical IoT, we actually separate that out on our network. We work with clinical engineering, quite honestly, and basically ensure that those devices are not part of our regular network. So we've segmented out. The other thing is that we don't allow outside devices get to our production wireless networks at all. So again, we segment that out to a guest Wi-Fi. So anything that we use within our network frames, we're very careful about putting that into our environment. So we like to control everything end to end, and then also put up firewalls and other things to protect us.
Jeff, concerns from a nation state standpoint?
Yeah, for sure. It's like the confluence of events. You have healthcare industry and the country as a whole taking on greater risk by going remote and everything that comes with that. At the same time that the geopolitical climate is heating up. And then you have adversaries who have the capability, intent, and willingness to target the homelands, and particularly the healthcare industry. And I think it was even just this summer, the North Koreans developed a ransomware, Maui, specifically to target the healthcare industry. So our adversaries recognize the urgency with which when you're hit with a cyber breach, what that means and psychologically, and they apply off that. So yeah, these aren't great times, and unfortunately, it's not going to get any better geopolitically. We talked a little bit about this beforehand or this week. It's just the timing was horrific with this expansion of people work remotely and everything that comes with that, with things not going well with Russia and Ukraine and with North Korea and Iran. And we can talk about all those or some of those later or after. So yeah, our adversaries pick up on that. They'll target it and they'll go after it. The Internet of Things, we're worried about, devices, and the Chinese are very sophisticated in this. The devices, they're older devices, are not supported by, software updates anymore, and they just get kind of forgotten about. And our adversaries know that, and they're not just looking to get information, looking to cause havoc. So, yeah, it's a concern for sure.
So the White House recently gave CISA guidance or directive to quote unquote step up their game on healthcare as part of critical infrastructure.
Yep.
Obviously, we see whether it's in Ukraine targeting of hospitals, both with kinetic, but as well as psychological and cyber weapons. What can we expect from that? And you can go anywhere you want. Mandates, legal requirements, given some of the folks on the panel.
Sure, yeah, I'll kick it off. So I'm sure, talking for big FBI here, although we're small FBI in Cleveland, but big FBI, I'm sure we'd have loved to have had it been routed to the FBI as well. All those reporting requirements of 72 hours. In the perfect world, let me back up a little bit. Where I see it going in terms of information, I know Big Bureau at the enterprise level, we want as much information as we can get, as fast as we can get when there's been a breach or when there's been an attack on the healthcare, any infrastructure really, but for healthcare in particular. The reason is, our adversaries will use infrastructure, burn it up, and move on to the next thing. So it's critical for us as an investigative and national security agency to get hold of information quickly so we can make operational decisions. And so although your company, your entity, your hospital, your firm might be hit and you're handling it in-house as well you should, we want to get involved as much as we can and help as much as we can and take the information and use it across the U.S. for the benefit of the country. So I would, back to your initial question, broadly speaking, I would expect there, as the geopolitical climate continues to heat up and our adversaries are not letting off the gas in this, that the push for increased reporting requirements and more information and scale and scope will be coming down the pike. I know the Bureau will be pushing that for sure because we feel it's not just an FBI problem, it's not just a U.S. government problem, it's a United States problem. So I think from that perspective, I think the mandates are going to increase. And I don't think it's going to end anytime soon.
Fran?
Yeah, the new pronouncement comes under a executive order that came out a couple years ago, and healthcare is maybe second, third tier group of critical infrastructure industries that's being addressed by CISA. But the underpinning of CISA is it is supposed to give support to the public and private sector. So the idea is that government is going to work with public and private entities and help out here. So while there will be, I think, many more specific guidelines that come out of CISA looking at healthcare, and they're likely to be similar to the guidelines that have come out for other industries. But one of the biggest things I think that is likely to come out is a mandate, if you will, that breaches need to be reported to CISA almost immediately. And the idea being that CISA is then going to help out and not be necessarily a regulatory agency looking over the healthcare industry, but a partner in trying to work through these things and also coordinate, as Jeff said, so the government has a lot more information basically about what's going on, who's breaching what, who the threat actors really are, those sorts of things. And, maybe can work through some of these things on a global basis much better than an individual healthcare provider, could do.
Yeah, and to follow up on that, Fran and I were talking about this right before. There's an interesting convergence where there's for a long time been a desire for lots more information a lot faster, and now we've got some formal legislative authority to CISA to demand that, and they're going to demand it on ransomware. But it butts up right against the reasons why organizations have been reluctant is because of liability and regulatory risk, right? And so there's going to be a challenge, as I see it, around how do I define an incident to make it reportable and to figure out the timeline for, I'm calling it CIRCIA, and I think CISA called it that, this new reporting requirement when it comes down, and managing the risk internally from, is it a reportable breach under state data breach reporting laws? Is it in this space? Is it reportable to HIPAA? And often organizations have cross-cutting requirements, SEC and others. And so it'll be interesting to see how that played out, because historically it's played out where the conservative call is, well, we're not going to report it. We're not going to get the FBI in our house unless we have to, right? Which, I think that's changed. I think that's changed a bit.
No, that's a great point, right? Because most people don't want to see the FBI coming through the door, right? I don't know why we're so nice and friendly. Look at me, I'm very nice and friendly. But
you got that square jaw.
I know. No, but that is a great point, right? It's a sea change even for the FBI, I think, and I've seen it, 20 plus years, and I've seen even the 5 years in this position, right? Where that's why for us we want to get left of boom, so to speak, I guess, in our terminology. So these CEOs and the CIOs could know who we are. So when something does happen, it is an unfamiliar face. Like we're not a regulatory agency. We're not looking to get information and then pass to a regulatory agency. We just want to get the evidence, technical artifacts to get at the folks sitting in Beijing, Moscow, and Tehran. Like, of course, we're interested in server logs and those type of things, but we're at the point now, and we've scaled up so much in the past 4 years. It's actually been awesome to watch from the inside. We've scaled up so much now. We are developing subject matter experts on individual persons and groups sitting overseas. So like we want to get chat logs involving negotiations for ransomware, so we can start building up profiles, and all the apparatus that the FBI has built up over 100 plus years, we can apply all that to this target set. So that's why we love that it's kind of going that way, that there's more information flowing in, but we're now getting at a more granular level, not to look at the company. We view the companies as victims, right? And we're like no different, want to handle it no different than when there's a kidnapping victim. We treat the same way because we recognize if we can get through this U.S. company and get what we need to get at that guy sitting in 10 miles outside of Moscow, then we're protecting how many future companies across the states and how much more money is going to be saved. And we're trying to push so hard on this now, knowing that it could turn from a warm war between all our adversaries into something hot. And so I would say as an organization, we are pushing super hard on that to put us in the best possible position so things heat up to a far higher temperature.
So I'm gonna pivot that for a second. So historically, U.S. policy has always been symmetric response. Whether that's you blow up a ship, we'll bomb a base. Something that is an eye for an eye. If you want to go back that far, we as a nation, with the exception of obviously what Jeff has said over the last few years, we've made significant changes as a nation in our cyber posture and cyber approach. But prior to that, it was wanting is probably the fairest way of saying it. Usually when the nation is struggling with it from a federal standpoint, we tend to see legislation start changing as an effort to get us, the commercial sector, to behave differently. Obviously, there's a slathering of new regulations, whether if you want to look at Ohio or California or even more recent ones that are working their way through the system. What should we expect over the next few years applicable to healthcare for state legislation, federal legislation in this space?
So, I mean, I'll jump in. I was just on a panel where we surveyed some. And what's interesting about the healthcare space is when you talk about covered entities under HIPAA, right? All of the new state consumer laws, and starting with California, exempt HIPAA covered it, right? So there's a carve out to try to say, look, we're not going to try to steal the space and try to have overlapping obligations for covered entities under HIPAA. So the consumer stuff is going to sit over here. Now, often there can be some debate over exactly where that line's drawn, but where you are seeing a big impact is sort of stuff that's ancillary, that's in the healthcare space, but isn't covered by HIPAA because it's not created by a covered entity. So healthcare apps, right? Apps that that I've got my Whoop, and I don't know why I track all these things about myself, but it just tells me that I'm not doing great things, but I do, right? And it's this great dashboard, and a lot of people would think, oh, that's okay, well, that's sort of health related, it must be HIPAA covered. Well, it's not, right? Who remembers digital contact tracing? And no one remembers because it never got off the ground because Apple and Google shut it down. But it was this idea which had some actual some potential to it until privacy trumped over efficacy. And the idea is, we track things with an app. Well, the problem is that everyone's initially like, well, that'll be covered by HIPAA. Well, no, it's not. And so we're increasingly getting into this area where there's lots and lots of health data, but it's getting collected on the consumer side. And that's where I think you'll see that one of the biggest effects of the state consumer laws. But generally speaking, it's still going to be in the HIPAA space. And there, HHS and OCR have been at the leading edge in terms of requiring much more alongside with financial services. But I'm interested in Fran's perspective in terms of what Fran just said.
I mean, I don't think the states are going to look at targeted legislation or directed or regulations directed to healthcare organizations, because that space, for just the reasons you said, I mean, that space has been taken by the federal government, and there would be all sorts of legal issues if the states started trying to co-regulate the exact same space. But there are other things that all the general consumer and privacy laws, reporting laws for breaches, things like that. A lot of those things do relate to the healthcare space as well. And so if you have a major breach, you not only may have to report it to HIPAA, but you may have to report it to all of the states in which your patients reside. And all of those states may have an entirely different reporting criteria. So, you can't just draft one letter and say, here's our notice letter, because it doesn't work for every state. So, and each state has its own, setup. But I don't see, I don't see regulatory action coming down from the state specifically directed to this arena. I don't think that's going to happen. There is legislation, in Congress that is hopefully going to look at the healthcare space in a little more detail, and I think that's probably more likely to get off the ground, assuming we have a workable legislative branch by the end of this election, which isn't at all clear. But there are bills that are in progress and that could impact the healthcare space from a federal level, and that is where I would expect to see the activity.
And just one other, the other area that we're seeing a lot of attention that's again related to the healthcare space is most of the newer laws, including the revisions to the California law, define. They're actually now having two categories of data: personal information, protected information, and then sensitive information. And sensitive information almost always includes now anything biometric related, and then genetic data. So if you're in if you're in the health space and you're trying to do research, come up with products, new devices, that's where you're going to have a lot of concern because there will be additional requirements and additional limits on how you collect that and what you have to do with it.
Or whether you need agreement,
Right.
sign off
Explicit
waiver
consent,
from
yeah.
the consent.
Yeah, the Colorado law and Virginia. Colorado goes the
Illinois,
furthest. Illinois already had
Yeah, right.
the most potential liability and needed explicit consent, but both Colorado and Virginia, under their general law, require, it's got like 3 adjectives, I can't remember, explicit, undeniable, some sort of beyond just consent. And Colorado even explicitly prohibits gaining consent through certain measures, including something they call dark patterns, which is only lightly defined.
We can solve all this with cyber insurance.
Not sure.
Maybe.
Talk amongst yourselves. Who wants to take that one on?
I mean, I'd be curious because this is an area that's sort of interesting to me from the start. It was interesting that remember when CISA was trying to get enough information so that everybody could have standard underwriting. I don't know whatever happened to that. I remember talking to some, yeah. But I mean, what I'm hearing when I talk to people and underwriters and insurers is it's just way harder to get it. I don't know if you guys are experiencing that or.
Yeah, I can comment about that. We just recently went through an exercise of re-upping our cyber insurance. It has changed dramatically. I can tell you that the information that they were requesting from the health system is just over the top. What you're seeing is a great increase in the cost of the cyber insurance and less coverage. So when you look across, we're making tremendous investment in a cyber program. Millions and millions of dollars we're spending upon, putting together a program. And we're finding that isn't enough for what the cyber insurance is wanting. So it's very difficult at this point in time. A lot of executives, at least I can tell you at Metro, we're just basically looking at, what is the proper mix of this coverage?
One thing that some of I've noticed lately, the reason cyber insurance is becoming so much more expensive is because there have been so many more claims. And when this first came out, not too many people had the policies. They were relatively cheap to get. And then everybody jumped on board. And, I've had clients say that going through this process to get approved by the insurer has been helpful to them. So, it's not a complete waste of time, but one thing I've seen with some of our clients is they're looking at other types of insurance that might cover some of this. For instance, I just had one recently where they had a breach and they were claiming under their trade secret policy because, they had broader coverage and it applied. They had more coverage, dollar wise. And they could, finagle it into, and the insurance company was, agreeable that this fit into what had happened and what had been stolen from them on a hacker basis. So, it might be good to be more creative when you're looking for insurance these days. And the other thing I think that, particularly in every space, but in healthcare as well, you need to look at what the policy actually covers because some policies are not going to cover every kind of breach. So if you have a hacker come in and someone in your organization clicks on a phishing email, for instance, it may not be covered because the policy may only cover unauthorized access. And once you clicked on that link, they're going to say, well, you authorized the access. And so our policy doesn't cover this. Or other things I've seen is that where the policy covers a breach that's a result of some problem with the software or the hardware, that doesn't apply to every situation. It may not apply to every ransomware attack, for instance. So you have to be it's hard to know what you're actually buying sometimes. And it's getting more and more expensive, as you said.
Yeah, to that point, we did a panel, and it was 8 months ago now, with a guy who sues insurance companies for coverage. And, it's interesting to have him and the insurance companies on the panel. And one of the things he said is exactly that, right? Is that so ransomware is the problem because ransomware makes everybody a target. It used to be you have sensitive data and then you're a target. Now ransomware, everybody's a target. Lock up your system, you got to pay something. And so the insurance companies, they've never been able to underwrite it for it. And now they're having to pay out a lot more. So they've got to figure out how to manage that. And how do you manage that? Well, you start to scrutinize it. And so now, and then be more explicit is what the insurance companies were saying. They're being a lot more explicit about, okay, these are the things that are within this policy. And if you don't have this, we're not covering it. We're not going to cover, under more generic aspects of the policy. And then sublimits for different things. And then what I've been hearing is it's 6 months, even for a medium-sized business, to go through the underwriting process, even if you're relatively well positioned already. You already had it, but just to re-up, it's taking 6 months now because they're scrutinizing a lot more. Which again, as you said, Fran, that actually can be helpful, right? A meaningful underwriting process can get your cyber hygiene to the opening comments in better shape.
So one of the underwriter exclusions that we're starting to see work its way into policy or work its way into policies as a means of not paying is a reference to, in essence, the nation state sponsored actors. So they're writing it in. Usually you see that act of war disclaimer. Kind of segueing from that, obviously, Jeff, you're working clearly with the nation states, the Chinas, the North Koreas, Iran, and Russia, just to name a few. But China's made it very clear, publicly stated their intentions of stealing IP, stealing trade secrets, what have you. How do we see the nation state, those actors playing in this space? What is their interest?
Yeah, what's interesting is, the Chinese sometimes seem to follow the Russian path. Disinformation in general used to be almost exclusively Russian purview. Now the Chinese have gotten into that space. I mean, separate from healthcare, just in general with the country, ransomware is now far more cottage industry, far more than the cottage industry in Russia, right? You get, when we're looking like the blurring of the lines between cyber criminals and nation state actors and trying to put the FBI and USG flag right in the middle to find where that connection is. And does China follow that space if it goes on? Or the concern was when the war kicked off in Ukraine this year, you had ransomware groups, essentially not specific, but essentially declaring war on the U.S. and saying, like Conti, for instance, said they were going to do, anyone who supports Russia is we're going to go after them wherever they are, meaning the U.S. and the Western world. Now, does China do the same thing? If Taiwan ever kicks off, which is a distinct possibility in the next couple of years, based on what you see, if that kicks off, do the Chinese then, to keep the U.S. at bay, do they target the homeland? Do they see what the Chinese don't really get involved in ransomware that we see as compared to the other country we've mentioned, but do they get into that space? Do they target the healthcare industry specifically because of, again, what that does psychologically to a country? You've had some actors, Russian actors go after, law enforcement, 911, also for the same reason, just to really hit the country where it hurts, to try to negotiate things in their terms. So, not great news. It's not all doom and gloom because we're starting to catch up a bit in terms of it. And that's why, hopefully we as an organization, and certainly us as an office and our team, we can do whatever we can before it gets to that point, so you don't have to execute that cyber insurance. And that's where I hope we can, I think the Bureau has become better partners with everyone in this room. So we're availing our resources to you, and how we can help out and making sure those connections with the right people to make sure, when we push out pins and flashes and, cybersecurity advisories targeting in your industry that might be very specific, that we're having that connection at the tactical level, say, hey, here are the IOCs, are you guys tracking this? Just to make sure those communications are in place. So I think we're only, as this progresses, I think we're only going to be working closer on that stuff as it develops.
Show of hands, who in the room has a direct relationship with someone at the FBI? And you're not under investigation. Bunch of hands went down on that one. So if you don't have it, all joking aside, if you don't have a direct relationship with the FBI, I would strongly encourage it. Jeff is a pretty reasonable guy, 4 days a week. No.
Most of the time.
Most
So,
of the time.
but and that's a great point. Even just knowing who they are to call, and Fran and I were talking beforehand, just obviously in her line of work, just knowing who to call or get to an organization quickly. And doesn't mean by calling this an investigation is being opened or anything. Sometimes just discussion. Just know what resources we have. I think someone had mentioned TTXs, or you had mentioned TTXs, right? So organization, we're a big believer in them. We do them all the time. Usually it's for mass murderers or active shooters and terrorism threats. Really, we don't really do them for cyber computer intrusions for us in terms of our reaction. But we routinely bring in partners from the outside to sit in on our TTXs so they can see how we do business. The example I'll give is we brought the Jewish federations in from each of the major cities in Ohio to watch us go through TTX, so they knew exactly who would be responding to an event in Toledo or Canton or Youngstown, right? I would offer the same to you if you were having TTXs, large, small, in between. I'm happy to send one of my colleagues, one of my team, myself to go in, not as an observer, just to get someone to understand how you are doing business. We can better understand your needs, and maybe we could provide some input to that or some value to it. So, we spend a lot of time, and I really push the team hard here in Cleveland to not to do less investigation per se, but we have to. It's like business development, if you want to call it that. But we have to invest our time in you, our citizens, and our companies, because we want to get to the point where we're doing that, where maybe it's less likely that you will be activating that cyber insurance.
So we got a few minutes left. What I wanted to do is open it up. I'm sure some of you have questions, I hope. If not, I have another set that they haven't seen, the Zinger page. And we'll just start throwing those out.
Speak around.
I'm kidding, I'm lying, I don't have a Zinger page. Any questions? No one? Yes, sir.
Should I get to the mic?
Sure.
You can get it. Thank you, panelists. Next week I'll be down in Columbus. 48 hours ago, we had new elections. Have you seen any initiatives coming out of the governor's office or out of state representatives to be able to support your efforts? We talked about things on the federal level, but I'd like to see if there were anything that can happen on the state level.
So I'm the only academic on the Cyber Ohio Advisory Board, which is was the brainchild of then AG Mike DeWine, and he has continued to support efforts by the advisory board to try to develop. And our main signature piece was the Ohio Data Protection Act, which raise your hand if you ever used the Ohio Data Protection Act. It hasn't done a lot. Oh, we got one. All right. But we do know organizations. It's an attempt to proactively incentivize cybersecurity. But what it demonstrated and what DeWine's continue to do is elevate cybersecurity as a policy area. And he just last year 6 months ago, appointed Kirk Harith, who's the head of Cyber Ohio, to be the new cybersecurity strategic advisor. And I just heard Kirk speak at the Ohio Cyber Range Institute. By the way, we have an Ohio Cyber Range. It's a resource that's still under development. It's based at the University of Cincinnati, where academics like me are trying to build training and education systems. And once it gets bigger, I know they want to try to integrate those services and offer them up to the private sector as well as the academic sector. But Kirk, I was amazed. He gave a talk at the little conference that my center does when he was new on the job, and he didn't have a lot to say. In 6 months, he's done a lot. Basically, he's gone around and talked to as many people as possible. He was up here in Northeast Ohio, met with the Northeast Ohio Cyber Consortium over at the clinic. Kirk was the chief privacy officer for Nationwide Insurance, and so he knows how to get things done. And he's got a lot of good ideas. He doesn't have a budget yet because he got created in the middle of the biennium. He's sort of carved out a little bit of budget. He's hoping to go in the next biennium, but it's a good sign. I think Ohio's moving in the ranks of states like Arizona, Colorado, and some others that actually have a really robust, centralized, cyber group. And so his job right now is, as he tells it, is to coordinate. There's a lot of smaller things going on. We've got a cyber reserve. We've got OC3. So there's a number of state initiatives, but they need some coordination. And it sounds like the last thing he said, DeWine keeps asking me, are we secure? And I keep saying to him, well, there's not an answer to that question, but we're getting some
We're working on
visibility
it. We're working on it.
onto where we're at.
There's two levels for that.
Yeah.
Are you secure as a state and those
Yeah.
departments that have to function?
Right, right.
But as you bring industry into the state of Ohio, they need to know that you are a state that's willing to work with businesses to be able to be successful in a changing environment.
Yeah, and as I understand it, he's trying to do both those things. He's focused on that internal one right now so that there's some visibility into the agencies and some coordination. But absolutely, I mean, Cyber Ohio sits under Innovate Ohio, and so part of the explicit mission is to try to develop the industry, but also to demonstrate that Ohio is committed to helping organizations to be secure.
It's a good question.
Well, it'll be interesting in, 4 or 5 years when Intel's sitting down next to us.
Right, and they're a big partner.
It's going to definitely become part of our ability to attract businesses and retain businesses in Northeast Ohio. I'm sure many of you are aware that the Air Force is reflagging Mansfield as Cyber Command for the Air Force, so that's underway, although that will take 18 to 24 months probably before it's fully built out. Okay, other questions? Yes, sir.
I just wanted to bring people's attention to the Verizon report. It's been issued since 2008 to 2022. It's a trove of information when it comes to cyber breaches. That's the Verizon report. And then when it came to cybersecurity, one of the insurance, one of the challenges was the capacity issue. There was such a demand for cyber insurance that everybody was applying for it at the same time. They had, there were people that were just saying, we don't need it, we don't need it, we don't need it. And then especially the COVID epidemic shot these cyber problems through the roof. So now everybody was rushing to get it. And so it was in large part a capacity issue in which the insurance companies put very tight underwriting regulations on. Because, I mean, there were clients that wanted 10 million and they could only get 1 million. So the insurance industry is kind of correcting itself. But imagine, I'll leave you with this thought. Imagine if you were trying to get building insurance and all the buildings were on fire. It really was that simple. There were so many breaches going on. But the Verizon report is very insightful.
Not to mention there are tens of thousands of arsonists that are willing to burn your buildings down every day. They don't even know who you are. Good point. Anyone else? Peter?
For each of the panelists, what would be the top 3 things you would recommend to organizations to protect themselves?
I would invest as much as I could on the front end. Your plan, your response plan, like everything I would put. If I had an extra dollar, it would be what I would do on the front end of things. I would train the guys. One of the things do I like giving up 4 hours, every 2 months to talk through a scenario for, a mass casualty event in Cleveland? No, I hate it actually. Right. But we need to do it because everyone around the table needs to know what their duty is for that team, and then I, as a leader, need to assess my folks and are they the right person for the job in that. So that to me has been the best as a leader, dealing with crisis response. That to me is the best investment in time and money are actioning response plans and talking and walking through whatever capacities. That to me would be the most important thing.
And for the healthcare industry, I'd say encryption is a huge thing. And it has to be the right kind of encryption. It has to work even when your off-campus doctors open up their laptops and look at information. During that period when they're online, the encryption has to still be workable at that point, because that's when ransomware and other kinds of hackers come into your systems, is when people are actively using the system. But it's amazing how many entities, don't encrypt their data. And that's it. It's not that hard and it's not that expensive. But it can be a huge firewall against, folks that are trying to steal it. I mean, if they steal the data and it's no good and they can't use it, you're a lot less likely to be hacked. So.
Just to add on what you were talking about, and it was mentioned earlier, you mentioned about asset tracking. I would say, organizations really need to take a very good look at their assets, where they are with their patching, their just regular hygiene of your servers, your PCs, everything that's out there. When we talk about assets, organizations have thousands of those devices. You need to make sure that all of those devices are being patched, or if they're not, they get off your network. I agree with you wholeheartedly. And it's not an easy thing. It's, when you get Windows patches and they provide it to you every month, you need to make sure that those are applied. That's usually what catches up a lot of organizations, is when that happens. The other thing is around threat detection, also being able to have eyes on organization 24/7, 365. And I know as we looked at that, we said, we're not very good at this. So we're going to get a third party involved and provide a better protection for us. So that's what we've done. We've looked across our organization and said, what is it that we need that we're good at? What is it that we need to really outsource that we're not very good at, that could raise the bar as far as our security posture? The other thing that I would say is, multi-factor authentication, it catches people all the time. And I would strongly encourage that if you don't have that in place, that you get that in place quickly. That is a very easy vector for folks to get into your network. We talk about phishing. Phishing is the #1 vector for an attack for you as well. So training your organization to be a culture of everybody's responsibility is cybersecurity, not just a security team. It's the entire organization has a responsibility to that. If they see a phishing email, they notify the appropriate people. You make it very easy for them. In our organization, if we get a phishing, something that's suspected phishing, there's a button that they can press, it automatically goes to our network operations center, and it's acted upon. So, you're going to have that. And even with multiple filters in place, you're still going to have a phish that gets through. And it's everyone's responsibility to be aware of that. So, we've put things in place where we tell people to take a pause, a 3-second pause before you look at that email message and click. You pause and see, where is it from? Do I know this person, etc. And we put a very big red banner on that. It's an external email. You need to take time and research it before you address it. So little things like that can save your organization a lot of difficulty with an attack.
And just to put those last two together, CISA just came out with guidance on phishing resistant MFA, which means don't use as an SMS, don't use telephone. It's basically FIDO or an enterprise level, but basically the new, which that's going to become the standard. I mean, so you worry about liability. Encryption can prevent some liability, but some of those basic things that give you reasonable security.
And just, when you talk about training, there are online training programs that everybody in your organization can use, and in my organization, in my law firm, we have to do these training exercises. Each individual employee and lawyer in the firm is obligated, to do these training exercises. You can do them at your leisure. They take, 20 minutes maybe, and they show you a bunch of, phishing emails. They give you specific demonstrations. They ask questions. But you have to go through this process, and we are, obligated to do it. It's something that I think every big entity that has a lot of employees ought to be doing, and smaller ones. But it's easier with a smaller entity to just sit people around a table and tell them what they're looking for. But this is something that that can be done fairly easily. It's not terribly expensive, and I think it has big rewards. So.
I would agree with that. We have something that we do every month. We test every employee through a phishing simulation test, and we look at phish that are attacks that are going on currently in the industry. and then we test people against a phishing simulation. And then when we do have people that click, we have a special training session that they have to go through so they can understand what truly to look for. What do you need to make sure that you stay clear of? So doing that each month, they're getting better and better. We've been watching this over the years. We've been doing this a couple of years, testing everybody every month. And what you do is you're seeing a trend go down. And so what we try and focus on are the things that people look for all the time and don't even think about it. So things like HR, policy, your paycheck, those are things that are heavy clicker. They don't realize that it's a fish. So when I talk about this too, it's not only that we test them on, that's just clicking a link, but giving up credentials. And there's situations where people actually are giving up their credentials as well. So it's out there.
So they stole my one about MFA.
Yeah.
So I'm going to go with a slightly different one than what I was going to say. I think just actually having an incident response plan. If you can get the leadership of an organization to sit down and say, okay, what are our actual risks if this happens? Yeah, you'll answer that question of, okay, where should my $1 that I have to spend now go? And it'll be different for different organizations. But if you actually look at, okay, where do I have sensitive information? Where do I have PHI? Where do I have liabilities that are not being protected adequately now? It becomes very obvious very quickly as you work through this is where my real risks are. Then I can adjust and adapt and protect those vulnerable areas in my organization.
I'll wrap that one up. I think so. Some great feedback for sure. I would. We actually have a fun war game internally with clients on what would we do if we had $1, and it changes regularly. The answer, we've talked about many of them, but we start with the assumption that someone's going to get through. It's just going to happen, whether it's from the outside or the concern that I'm losing more sleep over, especially the last 3 or 4 years, from the inside. As we see more financial pressure, whether we're in a recession or not, we're going to see more of our own associates accepting those, in essence, payments to open a door and let someone in the environment. They'll quit 6 months later. Bad things happen. So if I were going to spend $1, and I'm going to owe somebody some money when I say this, I would probably spend it on EDR, some sort of endpoint detection and response, some sort of AI-based engine to constantly look for the activity, whether it's somebody clicked on a link or somebody internal to your organization is doing something they shouldn't be doing. I would start there. Beyond that, Dave, you actually mentioned this one, patching. Almost all of the vulnerabilities that are out there are well known and well documented. With the exception of maybe Mr. Kane, I would suspect that the majority of the people in this room have never actually encountered or experienced what we call in the industry a zero-day attack. Anybody ever heard of that? Well, you guys better have heard of that. But a zero-day attack, we talk about them, and they're important things, but they're a little bit of a unicorn. They sort of exist, and they do exist, but they are exquisitely rare for most organizations. Why? They don't need a zero-day attack. They found a hole. The holes exist. They worm their way into an unpatched system somewhere and find their way in. If it were beyond patching, my next one would be immutable backups. The number of clients that thought they had something right, they had a policy, they had training, and then they're like, it's cool, we'll go to our backups, only to find that our backups are encrypted, or they try to restore them and they become encrypted with ransomware. It's a very painful lesson because your one get out of jail free card just went out the door. Tabletop plans we talked about. If you don't plan, you're definitely planning to fail. So with that, I'll close. I'd like to thank everyone on the panel, and I think I'll invite back up Mr. Brian Lane for his closing comments.
What an incredible conversation. And I want to thank everybody for attending. I want to thank my team. I always state this at the start. They do an amazing job putting this together. So I want to thank them. I want to thank my dear friend, Andy Jones from Fortress, for his excellent moderation of the event and for his means of making people laugh, smile, and care. I want to thank Chris, David, Fran, Jeff, and Brian. Love the spelling too. Our panelists for sharing your insights and expertise this evening. I hope you all enjoyed this conversation as much as I did. And in just a moment, I'll invite you to go next door here and have some refreshments from our good partner, Edwin's, who promotes leadership in restaurant institution for formerly incarcerated men and women. The food is unbelievable. So please take some time to hang with them. And now I want to take an opportunity to recognize and thank all of our event sponsors. It's with your support that we can offer this extraordinary event. So thank you to Ethical Intruder, Fortress Security Risk Management, KeyBank, HBK, Vertilocity, the HIMSS Northern Ohio chapter. How about this? Join. Talk to them, join. You got a little extra, yeah? All right. TEC Communications. I want to thank Champs Group Purchasing and the Essentials Group. And a special thank you to ACHE, the Greater Ohio chapter, for promoting the event. I also would like to thank our corporate sponsors. They're listed on the tabletops in front of you. And each are important and valued partners in the work that we are doing to meet our mission and impact health within the communities for whom we serve. We're grateful for their support. Lastly, note this. This is actually pretty cool. Get ready. Lastly, I get the fun job of announcing our raffle winner. Courtesy of Champs GPO. We have 4 tickets to watch a Cleveland Cavaliers game from a suite at Rocket Mortgage Fieldhouse. And as a reminder, a raffle ticket was placed in the back of each of your name tags, at least the name tag holder, right? Please look as we now draw. And then, Andy, if you don't mind, can you make a drum sound?
We actually handed them out at check-in, so did anybody not receive one?
Good question. Yeah.
It's a hot ticket this season, they're doing great. All right, here we go then, where's the drum roll?
Nicely done. Nicely done. And if you need a person to go with you, I'm more than willing. All right, ready? 23, 67, 83.
Whoa.
All right. There you go. So we'll get that to you. That's cool.
Yeah.
Are you excited?
Uh-huh.
When are we going? All right. Well, that now concludes our program. Thank you all for joining us this evening. I hope you stay a bit. Go next door, have some food, enjoy each other's company. So let's continue the conversation. I'm missing something. What am I missing?
You're not missing anything, but it is a very nice night actually for November, and the deck is open. So
Yeah. If you have not been on that deck again, get out there. Seriously, you got to see it.